I'm Michael Schutz at Trinity County News, and I'm sitting here with Eric Todd, and I'm going to let him introduce himself because he knows himself better than I do. And if you'll just kind of introduce yourself and what your role is here at the clinic.
Sure. My name is Eric Todd. I was born in Huntsville, Texas, but we were raised in Bryan. Been in the Brazos Valley all my life. 30 years ago, I started working for an organization called Brazos Valley Community Action Agency. And community action agencies were formed during the 1960s in the War on Poverty. And the idea was that the federal government wanted to do something, wanted to put money into addressing poverty, but wanted it to be a local answer. So our agency was formed in 1972 locally. It's a private, nonprofit 501c3. And I came to work 30 years ago. One of my first jobs was adult education. I taught in a high school before that. My parents were both school teachers in the Bryan school system. And shortly after that, I got into healthcare and have tried to grow healthcare for predominantly the uninsured and the underinsured initially, but now we are, we serve everybody. 18 years ago, we heard of a program that was run by the federal government called Federally Qualified Health Centers. And again, it was similar to the Community Action Agency in that there was a doctor that was in New York, and this was back in the early 60s, and he had this idea. He was going to take some of the med students down to Mississippi during the summer and serve the poor down there. And he got down there, and it was he saw such astounding poverty down there that he was emotionally, spiritually moved, and he went back and set up a meeting with Sergeant Shriver, who was head of Health and Human Services at this time for the federal government, a guy named Dr. Geiger. And he went to Shriver and said, the government is not doing enough to address the lack of health care in rural America, and got a grant and got actual funding, and that funding has existed since that time to set up community health centers throughout the nation. And so we heard about it. It was a time George W. was president, and George W. came out with his philosophy of compassionate conservatism, and he saw one mechanism to kind of have an impact was to embrace and grow federally qualified health centers or community health centers. And that was the time we came in. Kevin Brady was the representative in Bryan College Station at the time. His area stretched over there, and he wrote first letter of support for us to become an FQHC. Since that time, we now have 14 clinics. We have about 50 providers. We see about 43,000 unduplicated patients a year. Do about 150,000 visits, and we do that with an administrative cost of 6.8%. So awesome. I think we're living a mission. The mission of an FQHC or a federally qualified health center is to provide accessible health care and affordable health care. It's not free health care. It's a difference. And one of the things I learned very quickly into it, because I was a social science major in college, and I come from a relatively liberal perspective, and what I have learned though is that when somebody comes in and they participate in the cost of their health care, one, their compliance with their doctor's advice is higher, and also when they are participating, they feel like they've got some kind of skin in the game, and they belong more to the healthcare system. And so but if you've got insurance, you just come in like any other clinic. If you've got Medicaid, come in like any other clinic. Medicare is the same way. But if you're at 200% of the poverty guideline, if you're struggling, if you're working poor, then you can come through and go through our eligibility. We determine where you are in your eligibility, and we offer a sliding fee scale. So for the uninsured, you're at 100% or below the poverty guideline, you're going to pay $25 to come in and see your doctor, your provider. You're going to get your lab work done. You're going to have access to some other services that we don't have here yet, but we hope to bring them to Trinity. But, $25 to get high quality health care is pretty good.
It is.
One of the other things that I have really enjoyed about being part of this federal system, and again, it's not owned by the federal government. It's a nonprofit that has a volunteer board out of the Brazos Valley. Is that they expect us to quantify the level of our health care, and so we're constantly having to measure what kind of outcomes the medicine, the health care that we're providing is actually having on the patients. Are they actually getting healthier? Is their health maintaining? And that's something that, in private practice, you don't really have to do. You don't have to kind of prove yourself. You just have to run a business. And so we're constantly measuring indicators that are looking at, are our doctors, are our providers practicing the best standards of care of medicine? And that's kind of that's what we're bringing to Trinity County.
That is awesome. So, kind of explain the reason you're here, okay, and your visions for the future.
Sure. So, about 9 years ago, St. Joseph Regional Health System approached us, and they were running clinics in the rural counties, and we were running clinics sometimes simultaneously. But they approached us and asked us if we would look at taking over their rural clinics. And we danced for a while, tried to negotiate how we were going to do this. And for the last 8 to 9 years, we have taken over most of the rural health centers. And we saved them a lot of money. I think we have not decreased the quality at all. Most of the times we've used their own, the doctors that were in the community, and we just run a more efficient healthcare system. We've got some advantages as being a federally qualified health center. We can, that saved the system money. So one of the gentlemen that I was working with, a VP over there, ended up in Lufkin, transferred from CHI St. Joseph to CHI Lufkin. And they were running the clinic at the time and contracting with the local Trinity Memorial Hospital District. And he came to me and said, I think y'all can do this more efficiently and save the hospital district, save Trinity more money than us running it. We're a hospital system. We're not an outpatient primary care system. Likewise, you bring the expertise of grant writing and bringing some state programs into the community that weren't here and that we wouldn't have that expertise in bringing. And so I started meeting with the hospital district and CHI Lufkin over here, and we worked in agreement probably over 9 months to take over the clinical operations. We know it was a headache for the people of Trinity because it's just like us starting out as new. So even their medical records, all their medical records start out as brand new, and so everybody's got to go through eligibility, everybody's got to go through screening just like it's new. But we intend to be here a long time, so help us get over that first hurdle, and I think things will be fine. The true joy of being over here is y'all have 2 doctors that are fantastic. Dr. Kwan that's been here forever, and Dr. Deshpande. I can go to Crockett, I can go to Bryan College Station and talk to specialists, and they know these physicians, and they know the quality of medicine that they're providing. And so that part was an easy transition, and the staff, front desk and the nursing staff are really good. We didn't have to start from scratch, and sometimes we have to do that. So what do we see in the future? We wrote a grant to Episcopal Health Foundation. Episcopal Health Foundation came out of the Episcopal Diocese of East Texas owned St. Luke's. And at some point they decided that what they were doing is spending all their time running a hospital, and that didn't seem like a Christian mission that they were, that they had started with. And it's a huge hospital system, 12,000 employees in the hospital, I think, at the time. And they said, we want to sell it, and we want to get out and do more for the community that we serve, the East Texas Diocese. So they sold the hospital to CHI, and they took that money and they established a foundation. That foundation then goes out and tries to find folks that can use that money as seed money to increase the health and the prosperity of people's lives in the diocese, the East Texas Diocese. And so we were an early recipient of their grant, of their services back in Bryan. And when I was coming into Trinity, I went down to Houston and talked to the folks down there and said, right now we're in an interim period where we can't provide, we can't go after some state grants because they run in cycles, and they only open those up every 3 years. And what I'd like you to do is, one, I'd like you to fund women's health here, and until we can get state funding. And the second is, we've had this great experience of working with Texas A&M's School of Public Health and them establishing local-run health resource centers. And these health resource centers are again run by the people in the community, and they provide a couple of things. They provide transportation. They provide something called medication assistance program. So somebody that is at 250% below the poverty guideline. Almost every pharmaceutical company has some kind of assistance for these named drugs. That otherwise, if you don't have insurance, you really can't afford them. But if you fit in this income guideline, you go through this eligibility, you can get those drugs for free. And so you need somebody to help you work through them all, because there are so many drug companies, and every one of them has their own form. And so these are called medication assistance programs. And the other is just a kind of a case management to help you through a lot of the bureaucracy that you may need if you fall on bad luck and you need some help in working through all the health services and human services that are offered by the state or the nation or the federal government. And so we asked them to also fund the study and then the implementation of a resource center that eventually somebody, either a nonprofit or the hospital district or the county, would take over and run for the people of Trinity County. And they funded that. So those are two services that we're in the process of opening up and getting started here in Trinity County. We also are working with Texas A&M and trying to get through telehealth to bring in behavioral health, to bring in psychiatry, and hopefully another program called PharmD, which if you're 60 plus years old and you find yourself and you may have 4 or 5 chronic diseases and going to specialists here and there, and you get, before you every morning you've got a plethora of prescriptions that you've got to take for every disease under the sun, then some of those may have contraindications one after another, and your time with a pharmacist when you go fill that when you fill those drugs is a couple of minutes of counseling. Well, this allows you to sit down with a registered pharmacist through telehealth for 30, 45 minutes and let them go over each of those drugs and let them look at how much is being issued, because a lot of times you're getting one prescription from this doctor and one prescription from this doctor, and allows that pharmacist then to talk to your doctors about what is the best regimen for all these scripts that you've got. So I'm encouraged about that. It's proven to show some real benefits in
my dad was a victim of that. He had 12 medications when he was comatose. When we come back, we took him to John Seeley and made him sit down and go through them. They had him down to 5 because they're interacting with each other.
Yeah, that's the whole idea. So, those are some things we want. We're talking to Livingston right now about, us getting a contract so that the uninsured can get over for their imaging services over to Livingston at a reasonable cost. And we would love to get to the point where we can start bringing in some specialists from Lufkin. We're not quite there yet. We're still, we still got our feet wet here, trying to get become acclimated to Trinity County. So that's kind of, that's where we are. We want to do everything we can within the budgets that we have to serve this community.
Well, the importance that I see, and I've seen y'all's work and going forward, is being sustainable. And I see that y'all are very concerned about something being done right and it can sustain itself and keep going forward on it, because flash in the pan won't do anybody any good. And
our healthcare system, while we've got some great innovation is really good, but it's kind of like in public health. One of the biggest factors in changing the lifespan of people in the United States was really public health telling us that we ought to wash our hands with hot water and soap. That was huge. It's kind of like when we found penicillin, but actually when we just started doing some really common sense public health things. And so what we want to do is look at the most cost effective and the most what is considered by science the best standards of care that know that they're going to have the results in changing the lives of the health of people. And one of the things that we've realized also is that health is not about just going to see your doctor. Your doctor, your nurse is just a part of your care team. But the real central part of your care team is you. You've got to take some responsibility and some control and some understanding of your health care, and your doctor's there then as an extender of you being the center of your health care.
Well, I know that I got spider bit, and I came here, and I didn't believe that. I went home, and 2 days later I had a personal phone call from the physician telling me what I needed to do. And when I went back in again and took more tests, 2 or 3 or 4 days later I got another call from the clinic telling me, okay, you need to take these vitamins, you need to take these supplements to build yourself back up again on it. And I would have had to wait until the next appointment to come in to find it, and that follow-up is so important to me, and it just made such an impression to me. And you're right, if take time to be educated about us and what we're going through. 15 years ago I would have gone through this, it wouldn't have been a big deal, but at my age and my health, my body reacts different. And so
sure.
The fact that both of the doctors that I saw sat down with me and explained what I needed to do for what I was going through. And I think the education part of this is so important in taking time. And that's the one thing I really like about it here, was that I'm not rushed through like cattle and looked at. Both the physicians sat down and talked to me and explained to me why they were doing it, what I needed to do in reaction to it, and what the situation would be if I didn't.
I have my own personal story is I started going. I'm as bad as anybody else at doing annual physicals, and about 8 years ago I started having annual physicals, and then doing one of them 3 years ago. My family practice doc said, your PSA level is going up, and we need to keep an eye on that. Next year he said, you probably need to go see a urologist. And the next year he said, you're going to see a urologist. And I ended up with prostate cancer. And last September I had prostate surgery down in Houston. But if I hadn't gone in if I hadn't started and I hadn't been taking control to go to that annual physical, there's a good chance I would be dying right now. And those annual physicals are really important. That's that prevention that you're talking about. And having that having that lab work done that's able to look and having that contact with your physician that can look at the history of your physical life and can advise you. So yeah, we're big on prevention too.
And
One thing I wanted to tell you that I'm really proud of you were talking about what we're trying to do for Trinity County. We developed a partnership with a group out of Houston called the Rose, and the Rose has one mission, and it's to provide mammograms to women who don't have access to mammograms. And the Rose now comes to each of our clinics with a mobile mammogram unit twice a year. And last week, the Rose came to Trinity for the first time, and they provided mammograms for 18 women here.
awesome.
And these are women who didn't have to pay a penny. And we are those kind of partnerships are really important, because you're able to diagnose a woman in the early stages of breast cancer, and you got about a 90% chance of curing that, of that not killing her and that not being debilitating. And so while we can't provide those services, when we can provide a resource for those and bring them right here in the community, then I think we're doing a lot for the people at Trinity, and we're living our mission.
Well, I appreciate the effort, because it takes time out of your day, and you got to put effort into it. And just like this women's health, can you kind of go over what this women's health group is?
Yeah. Our family planning came about a long time ago. This doesn't have anything to do with abortion. This is women, just like I need a blood test every year to look at my PSA. Women need to have routine PAP. They need self-breast examinations. They need, if they choose to have a contraceptive, back in the 60s and 70s, the most prominent was a pill. Now they have depot shots, and they have estrogen or hormonal injection that they can, not injection, an insertion that they can have that lasts much longer, up to 5 years, and has an effective rate of reducing unwanted pregnancies up to about 99%. All of these are approved by the state, they're approved by the nation, and they are very effective at keeping women healthy and letting them also choose their, the time when they want a family. Also, we do STD screening, so and treatment. So the sexually transmitted diseases are detected and treated and not spread. So one of the first programs I took over with this agency was family planning, and I have supported it for a long time. Nationwide, we know that every dollar invested in women's health, you reap $3 in benefits of costs that would be incurred if you didn't have that family planning service.
Well, I know women's bodies react so much to the environment they're in, and it's constantly changing. As a pastor and as a counselor, I recognize that this is more than birth control. This is actually monitoring the person's body to where they know what's going on with them. And I think a lot of people misconstrue this as this is population control or something. This
right.
isn't. This is allowing a woman to monitor her body and know what's going on with her.
For a lot of people, sir, that annual women's exam, it may be the only medical care that person gets. And so during that screening, we're going to look at their blood pressure, we're going to look at their diabetes, we're going to look at a whole range of things, and a lot of times it acts as a referral to a disease that hasn't even been diagnosed, that can really harm that woman. And so sometimes it's that first entry point into healthcare for folks. And so yeah, it's very essential. And I don't think anybody thinks that women shouldn't have an annual exam, just like men should have an annual exam.
Well, I believe in it. And in
Yeah.
fact, Dr. Kwan did all the blood work for me, and that's when I realized what the spider bite had done to me. My hemoglobin was down, my iron was down, my vitamin D was down,
Yeah.
and I was wondering why I didn't have any energy. So
right.
there's so many things that are little things that can be taken care of really easy. I'm taking the supplements now and the vitamins, and I'm feeling much. Look at me, I'm feeling better. And so there for a couple of weeks after spider bite, I couldn't walk across the room without losing my breath. And
Right.
I thought, man, I'm going downhill fast. But Dr. Kwan sat down there and he explained it to me, and I'm feeling so much better now. I feel like, hey, I'm going to survive.
That's right.
And so I can imagine this being such a gift for the women. And I believe y'all have a group on Wednesdays where you can come in and
I got to tell you, I'm the CEO, and right now I'm acting clinic manager because we lost the clinic manager that'd been here. They moved. Her and her wife moved to Houston. To Lufkin. We're recruiting a clinic manager. So there are things in that this clinic's doing that I'm not aware of. And Wednesday, I'm not sure which one that is. I apologize.
So what I'll say is call into the clinic if you have a concern.
Yeah.
Something's going on, and say, how can what can I do to find out what this is? Even if you can't afford to pay for it, there's a lot of programs available, and so we'll have the clinic number going across the screen there when we talk about it, and we'll also advertise on the Trinity County News online. Look for their advertisement. They're going to be posting with us, and all of their events will be on there. Now, y'all have an open house coming
We
up.
do. October 22nd at 5 o'clock to 6:30. We feel like we've been here a little while now. We can kind of open our doors and introduce ourselves. I know the county judge is going to be here and some other dignitaries, and we'll give folks a tour through the clinic. We have, I don't want to take any credit for the clinic. The hospital district has done a great job at providing a facility here, and the facility is top notch. But to meet the staff will be given volunteers. We're going to have a giveaway. We're going to have 3 drawings for gifts at that for the people that attend. You even get extra chances if you get your annual exam or your child checkup before then, that you get a coupon to enter into that. We'll be doing some advertising where you can do a survey online and you automatically put into the drawing. But we want to get to know the community, and we want y'all to get to know us.
Okay, and y'all have a Facebook page, right?
We do, and it's just going up. I told you earlier I contracted with somebody, a graduate student in marketing at the Mays School of Business there at Texas A&M, and he's developing it, and I'll get you more information as I get along on that.
Okay, well, as we get it, we'll put it up online for everybody here.
Great.
So, please, if you have any questions, call the clinic office number, and they can refer you. There's a lot of programs that are new here that are developing. They have resources that they hadn't had a chance to advertise yet. And if you have any needs or any questions, I know I called and they referred me immediately to the person I needed to talk to, and I got my answers. And the support is here. They can help you with your medications if you qualify. And there are just so many resources that weren't here before that are here now. And so I appreciate y'all working so hard on it. Would you like to throw in a last little blip or something?
The one thing that I will tell you that we're working on, it may be 6 months before we get it here, but it's relatively new for us, is right now we're part of a program called 340B pricing for our drugs. And it's actually at or below the price that the VA is able to purchase their drugs, and we buy them. We're able to purchase them through a federal program. And an example of the benefits, I'll tell you one from my mom. My mom's 86, and her neighbor next door is 84 years old in Bryan, and her neighbor has asthma and lung problems, long-time smoker. And she's on a medication called Advir. And Advir is an inhalant. And that Advir costs about $300, $340 if you go buy it over the counter. And that's pretty tough for somebody
Yes,
on a
fixed income.
fixed income. And I think at our Class A pharmacy in Bryan, that drug is $33.
Awesome.
And so if you're a patient of ours, then you can go to Bryan. But we know that's a burden for people in Trinity. And so there's a relatively new mechanism, and we're looking into it right now. We'll probably get a contract relatively soon that allows us to take our 340B designation and contract with Brookshire Brothers, or contract with HEB, or contract with Walmart Pharmacy, where when our patients go into those and identify themselves as a member of the community health center, as a patient of the community health center, then they're able to get those drugs at those discounted prices. And I can't tell you their prices are all going to be the same. I can tell you what I kind of know about one of them, but they're significantly reduced. And so the idea is that they will have a virtual pharmacy that is for our patients. And so hopefully in the next 6 months to 9 months, if you come to get your prescriptions and you're a member of the patient of ours, then you don't have insurance, or your Medicare deductible is too high, then you'll be able to go to one of those pharmacies that we're contracting with and get those prescriptions at a significantly reduced price. And we think that's going to be a real benefit as well. And I forgot to bring that up. It's relatively new. We just talked to a company last week about it, and we're hoping to open it up for our rural counties. Right now, you have to go to the pharmacy that we have in Bryan to get those benefits.
Well, even at that, at least it's available, and that's not too bad a trip to Bryan. You know,
one of the ladies up here, said that her that works at the front desk was telling me today that she's made that trip to the pharmacy, and she's saving her father, who's a patient here, somewhere around $250 a month by going to the pharmacy in Bryan. But we want to make that accessible and easier when we can, just like, psychiatry. You're never going to get a psychiatrist that's going to be here, but through telehealth, we may get you a psychiatrist, that can help with ADHD and drug management and things like that. Same with behavioral health.
Yes, sir. Absolutely. Well, y'all got that long arm and the experience to know what to reach out to, and we appreciate what you're doing. And just keep us informed. And like I said, the more people know, the better they can take care of themselves. And I appreciate the effort that y'all doing. Thank you so much.
Thank you so much. Thank y'all for letting me speak.